However, this entity, MISC, or Multi-System Inflammatory Syndrome in children, it also affects young adults, and then it's called MISA, but it's basically the same process, we think, occurs almost exactly a month. They give kind of a window of 2 or 3 to 6 weeks, but from my anecdotal experience, it's almost exactly a month after a child has been infected. And it just infects a subset of kids, a very small subset. But we don't really know the risk factors there, although we're starting to learn a few of the genetic risk factors that may put certain children at risk for developing this and not others. But anyway, it presents throughout childhood. The younger children, and younger I'm going to kind of label as 5 or under, resemble another rheumatologic condition called Kawasaki disease. And initially, that's what people in Europe, where they were seeing this first before the bigger wave hit the United States in the Northeast kind of in early 2020, thought that this was maybe Kawasaki disease, because in the younger children, they have very similar features. And Kawasaki disease, it's also a rare condition, but it's inflammation of blood vessels. And most concerning is that some of the blood vessels that are involved in Kawasaki disease can be the ones that supply blood to the heart muscle itself, so the coronary arteries. Anyway, the children present for Kawasaki disease with fever almost uniformly. In fact, it requires 5 days of sustained fever, or five days in a row. And then they have other features such as rashes, enlarged lymph nodes in their neck, changes to their mouth and lips, like strawberry appearing tongue. They can start out with swelling of their hands and feet, and then it later begins to peel. And there are a variety of other features. Anyway, these children with MISC that occur about a month after a coronavirus infection, and it can be even an infection where they didn't even know they were infected, because up to 40% of individuals who are infected with this virus may be completely asymptomatic or not even know that they're sick. But we can test for those with antibody testing to show that they've had the virus previously.